Explain, what is parvo?
Parvo is it's a DNA virus that attacks the dog's immune system. So it's a virus that they get infected with, but it is what the virus does to the body that makes them so sick. So it's a virus that likes to prey on rapidly replicating cells. So bone marrow and the intestines and the blood. Those are like their three main places to go. It is transmitted what we call fecal oral. So they ingest it somehow, whether they lick something that has parvo on it. And parvo is an extremely virulent virus. So it can live everywhere, and it can live in such small amounts. It's bleach and basically Kennesaw that we use in the hospital at certain parvocidal concentrations. It can be killed by.
That's it.
But not every cleaner will kill parvo. So it lives everywhere. It's on your shoe. It's on the concrete. It could even be even if we bleach down that isolation ward. I'm sure there's still remnants of parvo in there because it's really hard to get rid of. And then an animal just has to come in contact with it, whether they lick a surface or they get some drinking water that possibly has some parvovirus from animals that are infected but not clinical, and they pass it in their feces. And then they ingest it. Like I said, it's fecal oral route. And once it's in their body, it first hits the tonsils, and then it spreads. And it goes, like I said, to the bone marrow and to the intestines. And then what happens is it destroys the lining of the intestinal tract so that animals are not able to absorb nutrients like we're supposed to. So all that diarrhea that they're having, because it's called the crypts of the small intestine, so they become non-functional. So they can't absorb any of the fluid, they can't absorb any of the nutrients, and they just get profoundly dehydrated from all of this horrible diarrhea, and then it inflames the crypts of the lining of the stomachs, and they keep vomiting, and then it can go into the bone marrow. And these animals die usually from dehydration or from sepsis because their white blood cell count drops, and then they've got this lack of a barrier in their small intestine for bacteria because the intestines almost become like a leaky hose. So all that bacteria that's supposed to be contained in there from the inflammation can go out into their bloodstream and they can die. So it's a virus. It's been around since 1967, and I don't even know how many thousands upon thousands of dogs died before they were able to develop the vaccine. And now that we have it, it's completely preventable if all dogs are vaccinated. And I mean, like any kind of virus,
right.
Look at COVID, right?
Right.
Any kind of virus, right?
Exactly.